name is Mohammed Shmaz from grade 7. Today our topic is dengue. Dengue fever is an infectious disease. It is also called bone break fever because it may swear joint and muscle pain. It is transmitted by a female mosquito called Aedes. No vaccines are available, so prevention is the best remedy. After an infection, mosquito bite symptoms appear in the patient: high fever, headache, joint pain, vomiting, fatigue, bleeding. These are the commonly observed symptoms of dengue fever. For diagnosis, a complete blood count CBCs will show total number of RBCs, WBCs, and platelets. Thank you.
The rises above 102 Fahrenheit with severe head and back pain, pain in the eyes with joints with nausea and vomiting. Patient management. As in case of other viral disease, complete rest should be advised to the patient. Patients should take plenty of fluid to avoid dehydration. Family doctor should be consulted, though there is no specific medication available. Any person who has been having fever for 3 or more days should consult a doctor if the person is feeling worse like vomiting, severe abdominal pain or bleeding.
The question is which areas we should cover and what to do. Clean the bird bath weekly, cover or turn upside down of containers, cap uncapped fence pipes properly, keep outdoor drains flowing, inspect flat roofs and pebbles after it rains, check the lawn ornaments, check the areas that hold water.
Preventive measures and control. For this prevention of diseases is very important to learn. We gradually measure the various levels of the disease at personal level. A person should be present mosquitoes biting by wearing clothes and covering the skin. Use mosquito nets which are sprayed with insecticide. Use mosquito repellents at household level. Spray every part of your house, under the furniture, behind the curtains, in the dark corners and in the storeroom. Removing junk items will eliminate the restings of the breeding havens. At community level, the surrounding of the house should be kept clean. No garbage or no solid waste should be collected on one side of the house. Spraying of insecticides should be practiced. So, stay healthy and be careful of dengue.